Hi, Dr. Katie. Welcome back to the show. To say that I am excited for this part two is an understatement. I'm so happy that you're here.
Hi, Vanessa. Thanks for having me back. And I cannot wait to answer your audience's questions about pet health today.
Yes, yes. You know what? I was thinking about this earlier, but this is a first. I've had a couple part twos or I've split up shows before, but I've never had a guest come back so soon after because we just had so much more to talk about. And there was so much just kind of left that we just had to come back and tackle some of this. So, I'm so appreciative and I can't wait for you to share more knowledge with our friends. So, welcome again.
Awesome. Thank you so much. It's a true pleasure.
Yeah, no, I am. Believe me, the pleasure is mine. I for those who missed your background and kind of like why you got into the holistic veterinary space, I encourage you friends who have not heard part one to go back to part one and to listen to that episode because it kind of Dr. Katie goes into detail about why she sort of jumped from the conventional paradigm to now more of the holistic and integrative space. But I am going to start out the show by asking you just a question that I was thinking about this morning, which was, uh, is there something or I'm sure there's multiple, but can you share with us a story or an episode or an experience that you've had in your practice in recent years that was just like really life changing for you, something that you've seen in your practice with a dog or a cat, something that just really, really shook you in the best way, like almost miracle.
Yeah, I work with a lot of really sick pets. I'm never the first opinion, or very rarely, just because people kind of we're trying the conventional side. It usually isn't working, and then they go down the rabbit hole and they're searching and trying a lot of different things, and then they stumble upon me, and then they reach out. They might try some other things, and then it doesn't work, and then they come. And so, with a lot of the pets that I'm working with, they might have had, a year of health issues, but even like 10 years of health issues is very common. And so, one of the big expectations I set up for people is going on a healing journey together and setting that mindset of this is that requires patience and perseverance, but also to following a plan based on like data and understanding how everything is interconnected. And so when we do that, there will be ups and downs, of course, just like anything. But when we have a plan and we have that patience and we have a community and support, it's much easier to stay on track. And so one of my recent members that actually joined my Blueprint program, she actually had two Yorkies that had severe inflammatory bowel disease, the worst that you can get, protein losing enteropathy. So very serious forms, like the most serious leaky gut that you can get. The immune system is overreacting. They're not able to digest their food. They can't process fats. And it's very, very serious and it's very hard to control, especially even with medications. And a lot of these pets are on multiple immunosuppressive drugs and it's not working. They're on low fat diets, usually prescription diets. And with my client, when she came to me, she had actually worked with a nutritionist to formulate like a balanced homemade diet, but they were still on like steroids and immunosuppressives and they weren't getting better. And it's really hard for her. She had two dogs with this health condition. And so, as we do, we always start with testing to kind of figure out what are some of these deeper layers of why the gut isn't working the way it's supposed to, what might be off with the immune system, are we dealing with detox problems? And for her, it's like our expectation is quality of life, right? Getting them to a place where they're feeling much better and for as long as possible. And that's like, kind of our baseline, especially for that type of condition with how long it had been going on for. Well, we actually started implementing the plan for both of them. Within 2 weeks, they went into remission, which I get goosebumps even
I
saying
just
that.
did. I just did.
She shares her story on our like weekly Q&A calls we have, and she's so grateful and her life is so different. And she also now understands too, if the other factors that can play a part, where she had to recently go to Mexico to help her parents get settled back there. So there were some changes. The dogs were back home. So they had like a little minor flare up of just some like
Mm-hmm.
mucus in the stool, but nothing like what they were experiencing before. But she knew what to do. Whereas before it was like you bump up the steroids and like, all those things that a traditional from a conventional like model you would do. and it calms them down again. And so she feels so much more at peace because she's not so worried about them, and she can focus on other areas in her life too because she knows they're in a much better place health-wise. So I think that is one of the big pieces that like I'm so grateful that I can help guide that because she's the one doing the work essentially. It's just giving her a plan that's specific to what her pets actually need. That's the key. And she followed it and she stuck to it. And it's not always easy, but it was just amazing to see within 2 weeks, her dogs are completely off steroids. They went through dental cleanings, extractions, didn't have a flare up afterwards. Like her regular vet is just amazed. She's like, I don't know what you're doing.
What?
You need to keep doing it. And she's like, I don't know how that works, but that's awesome. And so it's just things like that where it's like sometimes it's like, we're all like this, right? You sometimes question like, is this work? Does this
Yeah,
work?
yeah,
Right? And
yeah.
you're like, and you see situations like this where it's like, oh my gosh, it really does work. And sometimes we just have to kind of reset that expectation of time and
Mm,
have that patience to go through the process and stick to it rather
right.
than kind of getting off path, right?
Yeah. Yeah, absolutely. And before we pressed record, you and I were talking about fear versus, just being settled in your intuition and like moving forward with your pets, even when they have trouble or even when they're dealing with health concerns without fear and more confidence. And it's not that necessarily what that outcome is going to be, or you don't know, if the road is going to have some twists and turns, but to just provide this sort of hope and this kind of confidence for your pet parents and patients it's invaluable. Like truly, it's just incredible because a lot of people, like we touched on in the last episode, they just feel so stuck and without hope. And I feel like,
Yes.
it's such a perfect example of how it can look hopeless. And,
Yeah.
and I've experienced this too. And it's not. In so many
Yeah.
cases, it's often not, right?
Yeah, and I mean the thing too is we're getting reinforcement a lot of times from health professionals that there's nothing else you can do.
Right.
That's my personal journey. Everyone listened to the first the first
Yes.
session
Yeah.
together,
Yeah.
where we talked about that because I've been told numerous times just with my own husband's health journey and then also my pets and like going through cancer with my soul dog, there's nothing else you can do. This is it. And it's just not the truth. And I always say to my clients and the pet parents I work with is that I will never know all the answers. No one will. We can't. There's too much information out there and too much information that we don't even know and understand at this point, right? Just because it hasn't been researched and studied and there's a research paper on it doesn't mean that there's not another way. And I think that's something too. We kind of get stuck where we use the term evidence-based medicine. And I mean, you probably have a podcast on that, I imagine, Vanessa. Because
I know.
it's a loaded word. And
Yeah.
I'm not saying not to do research. I follow research, but also too, it's a matter of kind of opening our minds up to exploring different possibilities. Just as you mentioned, Vanessa, like that intuition, letting go, the emotional health, that energy precedes physical form. And people say it's woo woo, but it's not because we all experience it every day. Just like I shared the story of my client healing her dogs, I got goosebumps.
Mm,
That's energy.
yeah.
And so that's just a prime example of our bodies are energetic beings. And if we honor that, it opens up a whole world of healing for ourselves and our pets.
Yes, absolutely. And I like how you touched on the fact that it's not woo woo because it's not.
Mm-mm.
I
No,
mean,
there's like science
yeah, I
around
was
it.
going to say
I
it's
mean,
science
Dr. Joe
based.
Dispenza,
It
right? Like
I mean,
heart coherence.
there's so much
Mm,
behind this, and it's like when you the purest example I could think of is when you walk into the room and nothing is happening, but you can sense that something is off.
mm,
That in itself is energy. It's because we are literally energetic. We are feeling, we are responding, we are reacting to energy. And so our pets and we sort of dance with our pets and energetically, if
Yep.
we're off, a lot of times our pets feel it. If our pets are off, we feel it,
Yep.
and sometimes to a detriment, honestly.
I mean, yes, and I think too, I would just want to say, because I hear a lot of like guilt and then
Yeah.
people feel like shame around it.
Yeah.
I want people to feel their feelings, and it's okay to do that in front of your pets. We have to express it and go through it. Now, the question becomes, do we need to sit in it? Right? And where it becomes like a victim mindset and it becomes like our actual personality, where, we're always depressed and we're not asking better questions for ourselves to help us process that. That's the key. But
Yes.
it is very important and it is okay for you to cry in front of your pets, to feel sadness, to be stressed. And that's where when I feel those things, because I feel them too, is it's a trigger for me to check in with myself of, are there better questions I could ask? Is there something I'm doing that's like lowering my frequency? Do I need to move my body more? And it depends. We are all different with what's going to help us process that. But those are really important reminders because I hear it so much where we then get stressed that we're stressed in front of our pets, right? We all do it. I mean, I do it too. And I'm like, oh, my cat vomited. That's like my check engine light where I'm like not managing my stress.
Yep.
And so it's just becoming aware of those things that's really key. And don't feel bad that you have emotions and feelings. We're humans, we're meant to.
Yeah.
It's just being aware of how are we if we're processing them, and also too, if we're sitting in it versus like kind of moving through it.
Yeah. No, I actually really appreciate the fact that you tackled this really quick, or we went down this road for a second, because I am somebody who admittedly deals with a lot of guilt. And I
Mm,
think that because I've been in a health circumstance for several years, and it's very elevated in terms of
yeah.
stress. And, I've had even conversations with my own practitioner about it. And,
Yeah.
about how, especially Pearl, she's a feeler. Tilly, she's kind of like, she walks to the beat of her own drum. It's all about her. We just live in her world. And if you follow me on social media, you know this. But I mean, she probably feels it in a different way, right? But Pearl's
Yeah.
like this nurturer, the one that notices, the one that watches me. And yet also she's
Yeah.
the one that's dealing with more health concerns. And so I have really, really beat myself up off and
Yeah.
on, because I have thought about the fact that how have I contributed to these things that have sprung up,
No.
and
Yeah.
it's, to have a concrete answer is not, I don't know, it's, I don't know if it's possible to even really gauge that. But what
Yep.
it has brought to me is awareness, and how I could be a little bit more intentional, my favorite word,
Yep.
about my nervous system, how I'm handling things, how I'm reacting to things, how I'm reacting to Tilly because she's crazy,
Yep.
and that
Yeah.
also really stresses Pearl out, I think. Lots of things sort of have been brought to my attention. And that doesn't mean that I'm perfect, and that doesn't mean that I don't screw up, but at
Yeah.
least there's some awareness there.
100%. I love all of that.
Yeah. Yeah. So let's get on with these questions, because I've got several for you.
Let's go.
Let's go. Let's go. Okay. My friends, for those of you, like I said, if you did not check out episode or the first episode, part one, we got into a lot of detail about, gut health and microbiome, and we touched on diets and things of that nature. And there was going to be a section in there where we had some frequently asked questions, but we just, we got to talking, and there was so much information that I wanted to cover with Dr. Katie regarding gut health and, diets and a little bit of vaccine stuff in there, that we just didn't really get to it. So we're going to be getting to these questions now. And we've actually got a little bit more, because I went ahead and pulled my audience one more time, because we had a whole second show now, or a whole second episode. So one of the first questions that I got was issues finding a good way to control fleas. I'm trying to avoid toxins.
Yes. This is a great question. I actually have an entire YouTube video on natural flea and tick remedies. So that's on Dr. Katie Woodley, the natural pet doctor, on my YouTube channel. So this will vary for every person, right? I know California, or depending if you're in Florida or Texas, where it's really humid and hot, your risk is going to be a lot higher for fleas than say where I'm at in Colorado, where it's more dry. So wherever you're at, we have to look at, okay, well, how many fleas are there? Because this is going to also dictate how many layers of natural repellents you're going to probably need. Because when we're using natural flea and tick remedies, we're using repellents versus insecticides. So your flea and tick products that are prescribed from the veterinarian, or you go and pick up like Frontline, the topical stuff, Bravecto. We'll talk a little bit about some of these class of drugs too, because there's certain classes of drugs that have an FDA warning on them, and I will never touch them ever again. So this is really important for if you're in a high risk area, keeping in mind we're repelling fleas, we're not killing them. And some people have a hard time with that because it's like we need to just kill them. But I'm like, but the chemicals that kill them are also potentially killing your pet. That's the thing. And I hear it all the time too. Well, I gave him a dose of this and it was fine. So why can't I just give him another dose of it? And the problem is that we live in a toxic world. And so I want everyone to think about their pet as like a bucket. And our bucket sizes are all going to be different sizes depending on where we're at in life, our stressors, our health status, what foods we're eating. It can change every day. And what happens is every time we're putting something in, say like a flea and tick preventative, we're giving a vaccination, there's a stressor, we're filling the bucket up. And so that next dose of flea and tick, like preventative, aka conventional flea and tick preventative, could be the last thing that makes that bucket overflow and creates illness in your pet. So, and it can be delayed too. That's the other thing. It's not always, where immediately you see a problem. Usually that's not the case. And that's why we have such a hard time in like the more integrative realm of explaining like vaccines can create health issues. There's usually a delayed reaction, or the medications don't cause a problem right away, but they're like putting resistance on the body to healing. So this is really key with your flea and tick products. Shift your mindset around this is repelling, and I might need to use more than one thing.
Mm.
So, and that will depend on the burden of fleas in your area. So there's lots of great products, especially I'll name some brands for people who are in the States, but this is also too where we can use certain whole foods to actually act as a natural repellent. So garlic is not toxic to pets. There's one study where they literally like nasal gastric tube these pets with like pounds of garlic,
Oh
and
my
then they
God.
ran blood work, and they're all like, oh, their red blood cell count's a bit off. There's a risk of bleeding, even though the pets weren't bleeding. And so this is where evidence-based medicine, right?
Yep.
Like that right there does not tell me that like it tells me that, wow, garlic's actually pretty safe. There's like a pretty safe like dosage here.
Yeah.
And no animal is going to eat that amount of garlic. I mean, I can barely like stomach a clove of garlic. And
Same.
I love garlic, but it's strong, right? So this is where, yes, dogs and cats have different amounts that they can tolerate. We use less for cats. Cats can be more sensitive, but you can literally crush up a clove of garlic or half a clove for a smaller dog, and you can put that in the food, mix it in with the food, and it's going to create a natural repellent properties for your pet too. And then there's also things like parasite, like dust that you can put on your pets. Neem is a really good natural repellent too. Neem oil. There's also like neem powder that are in a lot of I think it's Buck Mountain Parasite Dust is one of the brands that's out there. But just using those herbs that have natural repellent properties, if you have a yard that is like nesting, like fleas nest in, we have to get rid of like those bushes or block off where the pet can go. Because if they're going into like a flea nest and they're getting reinfected every time, that's the problem. So that's really important. And then also to keeping in mind your environment inside. This is the number one thing that keeps people stuck with like flea infestations, because these things can survive a nuclear war, like literally. Like the different life cycles of the flea, they will just harbor down in your carpet, especially if you have carpet, and they will wait until like if you have like a holiday home, right? These things will just sit there. And as soon as you walk in the house and they feel the vibration, they will start hatching. So these things will wait. And then also too, they'll wait for specific humidity levels, things like that. So lowering humidity in your house can also help vacuuming. You have to wash the bedding, anything like if they're on blankets, you have to wash that daily in hot water. It is a pain, but
Ugh.
that is really, really important, or else you're never going to get rid of the fleas and it's just going to keep recurring and that's super frustrating. But there's also amber collars. There's a lot of fake amber collars that you can use too. There's also a lot of essential oil products. Make sure you're using good brands. That's really important. Animalio is a pet specific essential oil brand that is really helpful, and they have insect repellent remedies that you can use for both like your pets, and they teach you how to use it safely. So there's a lot of great options, but you have to use multiple remedies, especially if you're in a high risk area of fleas. That's the key. And then keep in mind, it doesn't mean you'll never see a flea. It just means that we're repelling. So you still have to check your pets. And, the flea combs and things like that are really, really important. Keep the environment nice and clean if you're worried about that. Your yard, don't have like long grass if you can avoid it, bushes where fleas will nest. If you have that, block it off with like a fence or something. So just doing the best things possible to help keep fleas from jumping on your pet and becoming a problem.
Good advice. Lots of good tips in there.
Okay, I want to share right before I mentioned I was
Yeah.
going to share the class of drugs that I will never
Oh,
ever
please
use.
do.
So the
Please do.
isosazolazine class of flea and tick repellents. So these are going to be things like Bravecto, Credelio, Simparica, NexGard. Don't ever use those. They are toxic. They have an FDA warning on them. I have personally worked with pet parents who have had pets that were completely normal, blood work normal, received nothing, and then 2 weeks later were in liver failure after receiving their first dose of this like drug. It is not worth it. And so I will never, ever, ever recommend it. The worst that can happen, well, fleas are not going to kill your pet. The worst is they can carry tapeworms if you're like, so we might get tapeworms. Yeah, it happens,
Yeah,
right?
they
And we
happen to
deal with the
pets.
tapeworm if it happens,
Yep.
right? So,
Yep.
but it doesn't typically kill your pet.
Right.
If, a lot of times cats, like feral cats, if they're flea ridden, they can become anemic, things like that. But that's like really severe cases. So this is where, the risk to benefit of using a conventional flea and tick remedy versus using your natural repellents, 100% natural repellents all the way every day for me.
Okay. Yeah. No, I stopped that years. In fact, I never gave any to my seniors because I adopted seniors for a long for I had several years. I had seniors, and then Tilly and Pearl are my first actually like young pet or dogs that I got when they were young,
Yep.
and I can't remember if I ever gave one to Tilly. It was years ago, and I really don't have a memory of it, but I remember giving a couple doses to Pearl years and years and years ago. And
Yep.
every time I did it, I had a pit in my stomach.
Yeah.
I felt sick about it. And then one day I was like, no
Why am I
more.
doing it?
Why
Right?
am I doing
Yeah.
it? There's obviously a reason why I have this feeling. I'm not going to do it anymore. And I did. I did the amber collars. Actually, they were a frequency tag now.
Yeah, I was
Yeah.
going to say there's also little tags that repel too that work really
Yeah.
well. It's great. Like the combination is the key.
Yes. Yes.
So, that's going to provide the most benefit. And I have a lot of clients that are in really high risk areas and, they might see a flea or a tick here and there and they're checking, but it's pretty impressive how well it can work.
Yeah.
But just keeping in mind, you're not killing, you're repelling. So and once again, I'd rather repel than like kill because those are really strong drugs. So very, very important. I mean, they cause seizures. That's the FDA warning is they're neurotoxic. That is how they kill the insect. And so what they said was, oh, it's safe for your pets because they don't have the same system. However, that is not the truth, as we find out. So those are things, and every vet should be providing a warning if they're using those and prescribing it. But unfortunately, that's not always the case.
Got it. Got it. Lots of good stuff in there. And I am in full agreement with you on
Yep.
just
Not
everything.
worth it.
Not worth it. No. Okay. Next question. Is there a supplement we should be giving almost all dogs or cats? Like, or is it truly vary on the pet's health? And I guess I'll throw in my own example of this. This is someone's question, but like for example, like I give both Tilly and Pearl green lip muscle oil because I feel like it's really good
Mm.
for their, like inflammation in their joints. And
Yep.
Tilly had a back injury last year, and I implemented this, and I feel like it's really helpful. So, is there something that's like standard, like you give most or no?
Yeah, it's a great question. I was thinking as you were saying that the omega-3s are a big one,
Yeah.
especially if you're feeding like a processed food diet, that would be like kibble. That's going to be higher in your omega-6s, which can be inflammatory.
Mm.
So that ratio, the omega-3 to omega-6 ratio is really important for naturally bringing down inflammation in the body. Most pets are deficient. And you can actually test too. There's a test called Omega Quant. So you can go to Omega Quant's website. They actually have tests for people too. It's a little
Huh.
pinprick that, a blood spot test, very simple for, you to do at home. But most of the time you go in, you bring this test kit with you when you're doing like your annual blood work for your pets. They'll draw the blood, they can apply it to that spot on the test kit, and you just mail the test kit in and you'll get a better idea. Is my pet actually deficient? But I can tell you most pets are. So omega-3 supplementation, whether that's through whole food, like you mentioned, green lip mussels, if you're feeding things like your small fish, like your sardines, stuff like that, using salmon as treats. If you're using just a fish oil supplementation too, make sure that you're using it up. If you're using an oil within 30 days, store it in the fridge. Once you open it and expose it to air, it starts to oxidize and it can go rancid. Make sure you're using good companies that are doing certificate of analysis. They're testing for heavy metals and other chemicals because it's a whole thing, just like any supplement, but especially with fish oil. So that would be one that I would definitely say. Even like puppies, puppies and kittens too. So developing, it's the same with like human babies, right? The brain is developing. So DHA, which is a part of the omega-3, is really important to supplement too with our puppies and kittens too as they're developing. So we're supporting optimal brain development and health. And then using a general omega-3 that includes your EPAs, your DHA. I mean, there's other
Yeah.
parts of omega-3 too. We don't need to go into all that. But yes, I would say definitely say your omegas are a big one. I find where a lot of people kind of misuse a supplement, I want to bring this up, is probiotics. So a lot of people are giving like the same probiotic every single day. And I get asked all the time, like, what probiotic should I use for your pet, for my pet? And I'm like, well, why do you want to use it? Is my question always back. So the problem is especially with a lot of the microbiome research we now have, and when we think about it, it makes sense. Like if we're giving, say, a product that only has lactobacillus, bifidobacterium, sometimes like cats, enterococcus is a common one, for using even just like Saccharomyces boulardii, a beneficial yeast by itself, and we're giving it every single day, we're actually like priming that microbiome to shift into a dysbiotic state. Dysbiosis means an imbalance because what's going to give, right? When we like 1 + 1 = 2, right? So we're adding something, something's got to decrease, and you can actually create an imbalance over time. Now, I love probiotics. I love, the microbiome. We need to, it's very, very important. So there are times and places for probiotics, and they can be very beneficial. So if you are using probiotics, I always recommend rotating them. So you're not using the same strain. So if you're using, say, like a product, this is what I do with my own cats. I have multiple supplements and I rotate them and I don't use them every day. I kind of go off of like, okay, this would be a good one to rotate. Some I use more frequently than others, like the omega-3s. But with a probiotic, I'm typically using it, you know, a brand that's more broad spectrum. So there's multiple species in it. I'll use that for like every other day. And then I'll take a break. I'll give the microbiome a rest. So I'm not, overfeeding a certain type of bacteria to the gut. And then I'll probably use a different brand. And then I'll add that in and mix it up and things like that. But I don't tend to use a lot of probiotics just because. And I find a lot of people do. And when we test the microbiome, because you can do a stool test to actually see what your pet's microbiome looks like, a lot of pets have dysbiosis and it can be related to the supplements that we're actually giving.
Wow. Wow. Yeah, you answer the question I was going to ask because I give both of my girls like more of a broad spectrum
Hmm.
probiotic. So it has several. I mean, there's at least probably 8 to 10 on that list.
Yep.
And I give it to them daily because I'm thinking, okay, and especially with like some of the things that I've seen, especially with the
Yeah.
girls' immune system. But
Yep.
now you've got me thinking like maybe I should pump the brakes a little bit or sort of experiment in that arena.
Yeah, because there's trillions. I mean, even with the
Yeah.
microbiome, like trillions of different types of bacteria. And, with the testing that we have, it's only test, like the amount of like types that we can test for has increased significantly, but we're not even able to like look at all of the different types of bacteria present. So if you think about it, we're only giving 8 to 10 at this highly concentrated amount. Like now, I use a lot of probiotics in my practice because I work with a lot of gut and skin health issues. So there's a lot of immune system. We're seeing a lot of dysbiosis. So there is, once again, a time and a place to use these. If you're using antibiotics, of course, we know we're going to disrupt the microbiome. So using like Saccharomyces boulardii or a spore-based probiotic like Bacillus are very beneficial to help like mitigate and kind of decrease the impact of those drugs on the microbiome. But when we're using it as a like everyday product, I would say rotation is really key. So that's where I'll use different brands and different strains. And then too, every now and then I'd be testing the microbiome too. So like every 6 months, especially if we know our pets are prone to like a GI issue, especially, like just test the microbiome. You do need to stop your probiotics 48 hours prior because once again, you don't want to see an impact on that. That's for microbiome testing.
Mm.
A lot of the other like functional gut tests, I think we talked about some of them last time. You don't necessarily need to stop probiotics because we're not measuring the types of bacteria, but that's really important. You want to see like what is the true status of the microbiome before you're actually taking that stool sample to send it into the lab.
Okay, okay. So, in regards to what was mentioned in the last show, like the comprehensive innovative pet lab test, that's not a
It's
microbiome
not a my
test.
it's not. So that is more of like a functional medicine test where we're looking for things like leaky gut. Do we have inflammation in the gut lining? Are we digesting our food? So we're kind of like assessing the pancreas's ability to produce enzymes. There is a marker that looks if there is potentially dysbiosis. So if bacteria is overgrowing, it will actually produce an enzyme and it's measuring that, but it's not looking at the specific types of bacteria. So you don't need to come off of like probiotics for that. If you're using like strong anti-inflammatory medications, obviously work with your vet. Like I'm not going to say stop your
Yeah.
steroids or like
Yeah.
things like that, but that can impact calprotectin, which is your inflammation marker. So, but that test there is not, it's not relating to the microbiome necessarily. We're looking at if the microbiome's off, we're probably going to see stuff off on that innovative pet lab test, right? Because if we have an overgrowth of pathogenic or bad bacteria, they're going to be producing chemicals that can increase the risk of inflammation in that gut lining. So that's why those two tests really complement one another and give us a really clear idea of what should we be supplementing with, right? And that's the other key thing too is you might not need those probiotics, right? So, if I'd rather test and see where things are at and then use the appropriate supplementation that's going to help with if there is an imbalance somewhere.
It's the same with humans. I'm sitting here listening to you and I'm like, this is literally the same exact thing
It
as what
is.
we should be doing instead of just going to, the store and being like, or worse, like going to Costco or something and being like,
Yes.
Centrum, like,
Oh God,
no.
Centrum. No. Use
It's so
Centrum.
true though. It's like we really it's better to know. And as much as I feel like I have done testing and I've done this and done that, it's like I still can probably toy around with the removal or taking breaks with certain things that I give them
Yeah.
and so forth. And I'm in the process of sort of, doing that now, but it can be super overwhelming and you're just
Yeah.
like, wait, what do I, but I feel like if I pull them off, that's where my brain goes, right? I'm sure you
They're
probably
going to get
think they're
sick.
going to get sick.
Yeah.
Yep.
Yes, and that's also too. I'm always looking at so if a pet's on a supplement and you remove it and they get worse, what does that tell us?
Right.
And the same too when you start a supplement and you see a flare up, what does it tell us? Because every supplement, just like a drug, is doing something to the body. And so that's where it's really key to understand how it's working so we can better understand why it might work or why it's not working so you can tweak and adjust too. So it's like really becoming like the detective because I find a lot of pet parents, and this is the same in the human side, I'm guilty of it too, is that you're like, oh, I heard this is really good for that. And then you just like give it, and you're like, I didn't actually think about my individual pet. Like, I'm just thinking about like a general symptom or a general disease. And I'm not thinking about like, oh, there's other things in this that are inactive also, or there might be like artificial flavorings, or even, I see a lot of times too in pet supplements, you have like beef liver, but your pet's sensitive to beef. And you're like, why is this not working? It must be the probiotic. And I'm like, no, it's like the titanium dioxide in that
Right,
probiotic. Like
right.
it's the carcinogen they added in for the whitening agent. Like that's probably partly not helping. So,
Yeah.
that's where also too, it's not always that the probiotics creating an issue or it's not working. A lot of times there's other factors with some of these products, and the pet supplement industry is booming. And there's so much sugar, glycerin, like chews. I'm not a big fan of chews. I'm not saying I will never use them, but a lot of times they're going to have a lot of flavorings. They're going to have other chemicals. They're going to have sugars in them to actually make that chew, and they're going to be lower in the active components that we're actually trying to use. So we're not even getting like the therapeutic dose that's going to help our pet for what we're trying to use it for. So it's like CBD products. CBD products like the chew. I hate the chews. I'm like, do you know what the therapeutic dose for CBD for your dog is? And I'll ask people that, and they're like, oh, I give a chew a day. I'm like, it's the entire bag. So,
What?
yeah. So, depending on what we're treating it for and depending on the brand, that's why they don't work very well a lot of times. Now, each pet's
Yeah.
different. I'm not saying, I can hear people screaming at me through the like screen. It
Right.
works for me,
Right.
Dr.
Right.
Katie. I'm
Oh
not
my
saying
gosh.
once again, but in
Yeah.
general, what I see is that I'd much rather use the tincture
Yeah.
because it's more concentrated. We can get a more effective dose. You don't need as much. And then we don't get all the junk that's in the chew.
Yeah.
Now, each pet's different and it can be hard to give, and I get that. So, once again, we look at all of those factors, but so many people waste so much money on supplements and is doing nothing, but you're essentially just giving like a tasty treat that has
A little bit.
artificial ingredients and things in it. Like,
Yeah. Yeah.
so
I'm not a big fan of chew. I've never really
I don't
been.
like chews.
Yeah. I've
I mean,
just.
yeah, they don't. There's a time and a place, and there are some pets where I'm like, okay, your pet like literally refuses everything. Try the chew.
Yeah.
Like,
Yeah.
but it's not my first go-to because it's
Yeah.
really hard to get to a decent dosage.
It makes sense. It makes a lot of sense. Well, this is going to, we're still on the supplement, in supplement talk, and this is going to roll right in because I got another question about glucosamine. And is it good for a dog? This was specifically for a dog. The Okay, so running, okay, is glucosamine good for dogs, and is running and or jumping or is it going to have a bad or adverse effect on them? Best recommendation for joint issues and joint prevention. I will tell you, I very much relate to the second part of that question because Tilly is a jumper and
Mm,
she had an
yeah.
inflammatory injury last year. And we think that it was just from like this chronic, we're not sure because we didn't, nothing happened, right? It literally was like she was fine 1 second and the next second she was like, oh, I guess what? I can't really walk well. There was not like any one moment,
Mm,
but I've thought about that and I think twice before making them, not making them, but engaging in really like rough, like lots of running, lots of jumping and things like that, because I'm worried that something like that can transpire again.
yeah, it definitely like you are at a higher risk with
Yeah.
that because you
Yeah.
have a previous history of like a back issue and things like that. I mean, this definitely, if there are previous issues or if you have a breed that's predisposed to those conditions. So you're like dachshunds, your basset hounds. There are breeds that are predisposed to these problems that you shouldn't be like letting them dive off the couch and, like, and sometimes like it's hard, right? You can't control everything. Like we do the best that we can with everything. If you have previous like knee injuries or surgeries, like you do have to be careful. That was with my Finn, my German Shepherd had two torn cruciate ligaments, ACLs. We avoided surgery both times because of what I was able to do with him. And he was a German Shepherd. So not very common to be able to avoid those surgeries. But this is where like if you have a known active concern, this is where I love acupuncture. That's where like that really helped Finn. Acupuncture is fantastic. Chiropractic care, depending on what's going on and the chiropractor, right? If you have a back issue and the chiropractor doesn't know what they're doing, they could really screw up your pet just like they can screw up people. So I like acupuncture over that, but I'm also not trained in chiropractor, so I'm biased. I'm just going
Yeah.
to say that
Yeah.
right there because chiropractors are probably yelling at me right now. So it
We've
can
got
help.
we've got some listening, I'm sure too.
I'm sure. And that's fantastic. And that's why I just want to say I've partnered with a lot of chiropractors in town with patients, and it's very beneficial. Just once again, do your research, do your homework, make sure they're not like manipulating like how they manipulate humans. It's not the same.
Right.
Very, very important. So I love the manual therapy. Laser therapy is awesome.
That's what we did.
So a laser's amazing.
We,
And
you know,
now
I,
it's
not to cut you
incredible.
off, but I literally, like, even the clinic told me, they said like Tilly, like, well, actually, she responded. I thought it was going in the other direction at first because her first treatment, it looked as if she was regressing, but really her
Oh,
body was
yeah.
just responding to the treatment. Like it almost, it hit that inflammation so hard that she was
Yeah.
just shaking through the night. I mean, it looked like I mean, I was a mess. And then within 24 hours, the girl started to walk around. And I'm
Yeah.
just
It's
going, what?
amazing.
And within a
Yeah.
couple treatments, she was jumping on the, I mean, and
You're
I
like,
was
no, less,
Oh,
less. Right.
literally, like you should just,
Like,
I was, it was, talk about stress. Like there, nothing touched that. Okay. Like I was running around like a, like a crazy person trying to catch her, stop her. And
yeah.
it's hard to create a dog like her, especially when you have a second dog. That's a whole other
Yeah.
thing.
Yeah.
But cold laser, absolutely A plus in my book.
Yeah, laser is really cool. So there's all sorts of there's all sorts of like PEMF,
Mm.
there's underwater treadmill. We would swim fin. I worked at a clinic that we had a saltwater pool and underwater treadmill. He couldn't do the underwater treadmill because it was right next to the pool and he just wanted to be in the pool. So we'd like climb out of the like and I was like, this is not helping.
Yeah.
And so we would just like swim him and just like, help with that. But the other thing too is, so you have all these like physical therapies, massage you can do. I love Chinese herbal medicine. I use a lot of that. So that will depend on the imbalance for your pet. So I'm not going to share any names of any of those because it'll depend on the what's going on with your pet. Very specific to the pattern and balance. So, but Chinese herbal medicine is really fantastic. So this is if we're dealing with like acute inflammation or there's imbalances that'll help kind of reset things. And then looking at like your nutraceuticals and supplements and whole foods. I mean, we've already talked about green lip mussels, right? So
Exactly.
can you add in more rich food sources of omega 3s? So even with like cats will eat like I'll use canned sardines for my cats.
Um,
And I'll also use, no salt in the water is what I do. And then also too, I get the little dried herrings and my cats will like chew, some of my cats, like one of them. The other two are like, skirt,
nah.
like go away, like meh, but they'll chew on it and it's also supporting their dental health too. So we can get creative with getting whole food sources in there. I'll sprinkle my other cat loves green lip mussels. I'll sprinkle that on her food and she just loves it. And so that's really important too is thinking about okay, what foods can I feed that are like superfoods for the beneficial properties? The other really important thing too is going even more foundational is we want to lower inflammation. So we need to be thinking about, well, what is the food I'm feeding? So this is where if we're feeding a processed food diet, talked a lot about this last episode. If we're feeding like kibble, how can we reduce the amount of kibble? Because we know that it actually increases inflammation in the body based on how it's produced to
Yes.
make that kibble. So that's a huge thing. A lot of people just doing that alone and getting over to a more minimally processed diet, like, lightly cooked, freeze dried, even a raw food diet, they'll see changes immediately. It's incredible. And so that's where once again, can we optimize those foundations of health so you don't need as many supplements or other things too.
Yeah.
And that creates resilience in the body. So you're removing the pressure from healing. So that's a really key thing for a lot of people to understand also because I find a lot of people are like, oh no, I just want to feed kibble. It saves me money. But then they're spending like hundreds of dollars every month on supplements and then they need medications. And then now we're creating other health issues and things like that. And I'm not against using pain medications when they're needed. There's a time and a place. However, there's so many great alternatives. And if we just once again clean up the foundations, you probably don't need those other things too. So
Right.
this just depends on the pet. I would say also I use a lot of there's a controversial thing, essential oils too. Essential oils are great. So copaiba, frankincense, myrrh, helichrysum. Those are all very great natural anti-inflammatories. They're also very safe for both dogs and cats. Dosage and brand, once again, are key. Less is more with essential oils. They're the most concentrated form of plant therapy, so we don't need more. The other thing too is the brands. Just like supplements, there's a lot of really bad essential oils out there. You don't go walking into, say, like Trader Joe's and buy the essential oils off, or even Whole Foods. Don't buy the brand that's sitting there. It's gonna be adulterated. There's gonna be some synthetic stuff. Make sure that you're using good brands. So that's really, really key. And there are good brands. I mentioned Animalio is a good one. Nice, safe one you can always start with if you're concerned. But those are really great because what you can do is you can diffuse them in an open room. But I also use them topically. So say like a dog, or a cat. Cats are also really they actually really enjoy this. Is put a drop of essential oil, like say copaiba is a great one to start with, and it's not super expensive. Frankincense and myrrh and helichrysum are like the most expensive
I
essential
know
oils
they
or
are.
they should be for a
Yeah.
reason.
Yeah.
So copaiba is a great one. Put a drop in your hands, rub your hands together, and just pet your pet.
Okay.
Dogs, cats. It's fantastic. It's going to absorb through the fur. And then if they groom it off, that's okay. It's
Oh,
safe for them to ingest and they're going to get a second benefit from that.
okay.
So a lot of my clients will use that. I use it too for my pets. I used it for Finn, especially with his knees. You can add a drop of copaiba to the drinking water also. So you can add a drop to the food. If you have a really picky pet, make sure you have a bowl of water that doesn't have anything in it too. That's always important. But we can use it multiple ways. So that's a great way to use a really concentrated form of plant therapy that's safe for them. Once again, keeping in mind dose and brand is really key for that. So there's a lot of different ways that I approach like physical health and helping like aging, or if we have osteoarthritis or pain and things like that. Those are just a few ways that people can start.
Awesome. And would you say that these ways are probably your go-to versus like a glucosamine supplement?
I still use joint supplements, so things like MSM,
Yeah.
collagen, like I still will use like concentrated supplements too to help support. I don't
Yeah.
think there's a problem there with using them.
Okay.
So it's one of those things too, like just with a lot of supplements, I'm a big fan of like pulse treating, where
Mm.
you'll use it for a period of time. So like say like your joint supplements, use it for like 3 weeks, take a break for a couple days and then restart it. So that way the body's not adapting to it and making sure that it's effective because that can happen over time with a lot of things in the body. So
Got
you
it.
don't want to be like throwing money out the window, right? With a lot of
Right.
these supplements. They're not cheap. So,
Which is
um,
like so easy to do.
yes,
Yeah.
100%. I mean, I love supplements, but I have a lot in my house and I rotate them and I also have them on hand just in case something happens. I don't need to worry about like emergent, well, you can't prepare for everything, but it's nice to be prepared with the things on hand. But keep in mind, if you're using things long term, pulse pulse them. So that way the body's not just adapting to it and it's not working well anymore.
Oh, that's a really good piece. And that's something like I said earlier that I'm kind of starting to think about a little bit more, is maybe taking breaks from certain
Yeah.
things. Just depending on what it is, right? Like I think that we have
Yep.
to be thoughtful and intentional and intuitive and maybe, reach out for some advice if it's something that we really feel super hesitant about pulling our
Yes,
pets
yes.
to.
Some things you shouldn't. Like if
Yeah.
something's working really well, like, that's it, and it's hard to say because there's so many different things out there,
Uh-huh.
right? That's where finding a practitioner that you can partner with is really key to help give guidance and things like that too. So,
Yeah.
that's an important thing. Like you shouldn't always remove like steroids. Don't remove steroids without your
No, a
vet telling you to.
tapered. Yeah.
Yeah, yeah. Like there's things that you have to be careful with that could create problems down the road. Apoquel, if your pet's itchy and they're on like Apoquel, don't just take them off of it because you actually get rebound itchiness and they'll get worse. So you
Mm,
have to wean them down. Acid reflux medications, don't just take them off of it. You will get rebound reflux and you'll be like, oh my God, like
yeah.
it's really bad.
Yeah.
So you just have to
That's
be careful with some of this stuff.
just with people are the same with PPIs. The same.
Oh, the PPIs are.
Yeah.
So
So
bad.
bad. It's so tough to like get off of those.
It
I
is.
have
And it
people
creates
that I,
damage. Sometimes you
yes,
can't.
yes,
That's
yes.
the scary part too,
Yeah.
is that sometimes if you're on them long enough, you actually can't like recover the function of what the stomach and the like the pancreas and all those things are supposed to be doing.
Oh my
It's
goodness.
hard. It doesn't mean
So
you
hard.
can't support yourself or your pet, of course, but it is one of those things before we like start using drugs nonstop every day for years, we have to ask, is this actually healthy and has it been tested long term?
Yeah, that's a big one.
Because most things have not been. Apoquel has not been tested long term.
No.
Cytopoint has not been tested long term.
And
Um,
there's a question in here about that because well,
yeah.
not specifically those, but I think, you know, to itchiness because I think people are having so many problems and it was mentioned in our previous episode, but in fact, we can go to it right now. I can go down the list. Let's see, where is it? I feel like it's somewhere, but it let's see. Best way to address chronic itching without injections. I have changed food 4 times.
Mm, I see this all the time. So it's not the food.
Okay.
Or it might not be the food. It depends. I see this all the time. Like it's the first go-to people go to is like, let's change the food. So my first thing is always asking why. Why is the itchiness there? This will depend. Every pet will be a little bit different, but the way we need to look at it is looking at, so I look at like the 5R framework, starting with what do we need to remove? We talked at the very beginning about flea and tick products. A lot of times what's happening is that there's things that are going into our pets without us realizing that are actually creating a trigger for the immune system. It's having to work harder or create more toxins, and those detox pathways aren't working well. So we need to just kind of become like aware of what are the detergents we're using, what water are we giving? Is it filtered? Yes, food. Okay. Are there things in the food that potentially could be? It could be a food sensitivity. That's very common, but a lot of times it's not the main reason why this is happening. What treats are we giving? And we need to look at how do we simplify. So I don't know if we mentioned it last time. I believe I talked about it with someone recently, like Tide
Oh
detergents.
yeah, yeah.
Yeah, I
Yes,
think we talked like it
we did.
lasts like 6 weeks in the
Yeah,
blankets,
yeah,
right? So
yeah.
even if you change
Ugh.
over your detergent, you gotta like, you're like, oh God, we gotta wait like 6 weeks, right? For this, like, just burn the blanket, like,
Yeah.
just get rid of
Toss
it.
it
Yeah,
in the
just go and
trash.
get like a new, like,
Yeah,
fleecy blanket or
yeah.
something. But that's the thing, like, most people are changing the diet, but yet we're still using like the laundry detergents, the cleaning products that have all these artificial fragrances that are like overstimulating your pet's immune system. Because keep in mind, like your dogs and your cats, they're not just like sitting there absorbing it. They are, but they're also grooming
Mm.
themselves. So they're ingesting all those chemicals. They're walking on the floor, they're going outside, all the toxins out there. So are we using herbicides, pesticides in the yard? Those are other things to be thinking about because those are going to destroy the microbiome. So first step, remove, reduce. What are the things that we can start removing and reducing to simplify? Diet, I like using forms of food that are very simple. That doesn't mean it's unbalanced, but what I mean by this is a lot of people are like, we need all the variety. Yes, you do, but now is not the time and place for it. We have to simplify when you're in a flare because your gut and your immune system is working overtime and they have to react to all the things that we're putting in. So if we're feeding like 15 different vegetables, 7 different proteins through like the diet and also treats and supplements and all the things, the body's working really hard. And if we have leaky gut where that gut lining's inflamed, the immune system's like, what are all these foreign things that are floating through and I'm exposed to now? It's going to overreact and it keeps your pet stuck. So simplify. Variety is not right now. No variety for 4 weeks. And there's a lot of diets that are more limited ingredient. I'm not talking about prescription diets, by the way. I don't use
That's a hard
prescription
no
diets.
here, friends. Hard no.
Yeah, I mean, if your pet's on it, okay. Like I work with people who
Yeah.
use, and that's okay. But if you aren't already on a prescription diet, I try whatever powers that be I can use to not have you go on a
Yeah.
prescription diet. So, but there's a lot of great fresh food options that you can use to help simplify, keep it easy for you, but we need to simplify things. The next thing is testing, right? We talked a lot about testing. Where are things off? Itchiness, you know, I don't know if I mentioned it last time. I have a client, her dog Cole came to me because he was itching like crazy and tried medications like the Apoquel, Cytopoint. Nothing was like working. And I was like, I don't think this is a like atopy or allergic dermatitis, right? And we actually did a hair tissue mineral analysis test, and he was the worst I've ever seen for heavy metals. Crazy.
Wow.
Like
Wow.
lead. Like I will always see aluminum, mercury. I
Yeah.
like expect I'm
Yeah.
like it's going to be there. I the levels of course are going to tell me like how well your pet's processing, but like lead through the roof. I was like, oh no, this is not good. Like, if this is not an Apoquel thing,
Oh
like,
my
you
goodness.
know, so this is where that testing, what's the microbiome doing? If we are lacking diversity because we've had numerous antibiotics or we have an immune system like deficiency, we need to know because that's going to help you dictate, do we actually need to do like a fecal transplant, restore that population? And then do we need to, support the immune system with things like medicinal mushrooms or colostrum to help it start doing what it's supposed to grab and bind and inactivate the toxins and foods and things that it's coming across that it's recognizing as foreign. So I always like work through these principles of starting like reduce, remove, simplify. Make sure we're doing some testing if you can. And then, what are some great natural antihistamine herbs that we can use? Quercetin is a great natural antihistamine. So, what that will also do is it helps support gut health. So, a lot of times the gut will also, it's a big source of histamine. Histamine is not a bad thing. We need it, we don't want it to go away. And this is where, though, if we're overproducing it, that's where if you like scratch, like you're scratching and you get all the redness, that's histamine being released by mast cells. That's a normal immune response. When we get too much, that's when we have problems with itchiness, allergies, welts, allergic reactions, things like that. Eczema, psoriasis in people, big time problem with histamine usually. So if we can use supplements to calm that down while we're kind of like figuring out, playing detective, reducing, removing things, that can help kind of bring that level of inflammation back down to make it easier on the body. So we're removing resistance to healing. So quercetin's a really good one. Nettles is a really great natural option. So even just getting like dried nettles, you can make a tea with that. There's nettle tinctures. And then also too, I support the detox pathways because there's a lot of inflammation. The liver processes a lot of histamine too. So we need to support these pathways. We need to support the lymphatic system. So this is the system that's also like very passive in the body that's like trying to also drain the toxins and get it out. And a lot of times we're just stagnant. Things aren't moving the way that they're supposed to. And so with the liver, there's a lot of great, I mean, we have a lot of great supplements out there that combine different herbs in them, but simple things, milk thistle, dandelion root. I love calendula is very helpful, especially if you have like skin sores. Calendula is very soothing, it's healing, it supports the mucous membranes. It's going to help that skin heal too. So looking at using some of those to just complement, open up those detox pathways, get things out. And then the other thing I'm typically looking at too is how do we bind those toxins? So this is like the removal phase of detoxification is a lot of times I'll use a binder. So this is going to be something like even just a simple like Ion Gut is a great brand that has humic acid, which is going to help bind to some of those toxins and remove them. Because as the liver is, putting toxins into the gallbladders going into the bile is going to then go into the intestines and then hopefully it'll go out in the poop, right, all the toxins, but it can get recirculated back into the liver if things are sluggish or not working well. So if we can use a binder that's going to help bind those and get them out, there's less that your pet has to process. So to reiterate, remove, reduce, simplify. Do some testing to figure out where things are off so you have a better idea of what to use. Calm down inflammation with natural antihistamines like your quercetin, your nettles, and support those detox pathways with herbs like dandelion, burdock root's another one, milk thistle, using calendula. You can use that topically, calming down that inflammation externally, internally, and use a binder to help get the toxins out. Would be just kind of like super simple of like how to approach that when you're itchy.
Wow. Wow. So much good information. And again, it reminds me so much of human health in so many
Mm.
ways, right? It's really how we approach. And I like how you brought up The lymphatic system, I did a major show on that with Dr. Perry Nicholson from Stop Chasing Pain, and
Mm,
he's like the king of the lymph system. And it's something that's often forgotten about. We just
yeah,
don't consider it. And a lot of times we're stirring things up, whether humans or animals, and then it's just recirculating, and so it's making
yeah.
us not feel good, and it's because our pathways are a little bit clogged. Like he gives an example of like the sewage system in your
Yeah, I
house.
use like the toilet, right? You're
Yeah,
just like,
yeah,
"Ugh," like,
exactly.
it's
Like,
not
come on.
working.
Yeah, it needs to be unplugged.
Yeah.
Okay, a couple more because I feel like, and I have so many, but we're just going to get to what we can get to because again, I feel like this could be the never ending podcast. It really, or the
Well,
never ending.
here's the sad thing is there's so many pet health problems and
I
like
know.
so that's the thing, but no, I'm here for all the questions. So let's keep
No,
going.
I love it. I love it. You're honestly the best. Okay. This is an interesting one. Middle-aged dog drops random poop balls. So
Fecal
just like,
incontinence.
what could this be from? Has done it for years.
Mm. So I had a client recently come to me and her dog did that also. And she was worried the dog had a history as a puppy of like constipation. And they had done a couple rounds of enemas. And she was like worried, like, did I screw up my dog? Like, did I create this issue? All we did was we added fiber to the diet and the dog doesn't have the issue anymore.
Oh my
So
gosh.
that
Okay.
may not be the situation here, but a lot of pets are really low and deficient in fiber. Now, this isn't like dump a bunch of Metamucil and like, you can create some issues, but you can use psyllium husk and just adding in like a teaspoon. I don't know how you said medium-sized dog, I think.
Mid-aged dog. So
Oh,
I'm not,
mid-age. So I don't
yeah.
know size. Obviously, like just starting with like a teaspoon, it's a small amount. Add a bit more water also to like the food and see if fiber would be helpful. This is where some people will use like pumpkin. There's
I,
different types of fiber too. So keep that in mind. Each fiber source will impact like the gut a little bit differently. But I would just start simple. Start with, a little bit of fiber, see if that's working. If that's not enough, acupuncture is amazing for fecal incontinence.
okay.
So is there a nerve issue? We have nerves that innervate the colon and they're going to help with contractility. And is there a problem there where the nerves aren't speaking to the gut because maybe there is a back issue, there's osteoarthritis or what we call intervertebral disc disease where there's compression of those disc spaces. That's where the nerves are coming out to then innervate the gut. So that can be a common cause a lot of times. So an X-ray can a lot of times show us if we have like bony changes along the spine to get an idea, is that arthritis? That might be complicating things. But start just simple. Try the fiber. That could resolve the
Yeah.
issue, and that'd be fantastic.
Yeah.
And then if not, then you kind of want to explore more of like, well, why is that happening? And go a little bit deeper.
Awesome. Yeah, I use pumpkin. It's a regular part of their
Yeah,
diet here, and it's been really helpful. But it's good to know that there's other forms, and they could differ. I mean, they could, there can be like a different outcome depending on what form you're
yeah,
using. Yeah. Yeah.
100%. Yep.
Awesome. Okay. Next one. If feeding raw, how often should I consider parasite cleansing dogs and cats?
I don't. I mean, so raw, this is a myth. So the myth with raw is that there's more parasites. This is just like the conventional medicine myth amongst my veterinary colleagues that will not die. So just to be, it is so frustrating. There's so many. So the thing is if you're feeding, and obviously if you're getting like you hunt and things like that, there can be, certain freezing times to kill parasites. Like there can be parasites in the food. If you're using any of like the pre-made raw brands that are out there that are testing, that are, Susan Thixton is an amazing lady. She produces this thing called The List every year, where she will vet and screen all these companies. They have to apply. They go through this rigorous process. You pay like, I think she bumped it to like $11 this year for it. I buy it every single year because she's so thorough. And just because a company's not on it doesn't mean it's bad. Just keep that in mind. But those companies are going through rigorous process of like testing, checking their food. They have a zero, the FDA has a zero limitation on like salmonella, E. coli, parasites, things like that, whereas kibble doesn't. They have very different standards, shocker, right? Not
Right.
super shocking for probably this people
Here's my
like people
shocked face.
listening here. Yeah, yeah. For anyone here that can't see us, we're showing our shock faces. Not surprised,
Not
right?
surprised at all.
Yeah, fresh food is more harmful than processed
Right.
food. That was
Yep.
sarcasm for anyone that didn't pick up on that. So, this is the same in the pet food industry. And so, there are more pet food recalls for kibble than there are for raw food. And so, this is where, like, I feed my cats a raw food diet. I am not doing parasite cleanses with them. Now, what I do recommend, and this goes for every single animal. So anytime you go into the vet and they're like, they're due for their dewormer, let's test first.
Yeah.
Because most of the time, your pet is not going to have parasites and they can check for eggs, they can check for parasites in the stool. So we don't want to just deworm us, ourselves included, and your pets, because that microbiome is really important to preserve and it's already being bombarded by all the toxins and other things in this world. So we don't just want to keep giving drugs when they don't need it, right? So if they need it, different story. There's also herbs and other things we can do, but this is something to keep in mind just because we're feeding a raw food diet. I don't know the background or the specifics, but if you're feeding a pre-made like raw food brand that's using things like HPP, or there's companies that are using like probiotics to like take like decrease the bacterial load too. The FDA is closely watching them and they're watching them more than kibble. So
I bet.
it's one of those things where I'm not concerned about parasite cleanses. Um,
Okay.
you're probably getting parasites from other areas, that you're a higher risk just walking outside. Like
Yeah.
Colorado Giardia is like out my front door. So it's just the reality.
Wow.
So those are things I'm not concerned. I don't think they need to do a parasite cleanse. Once again, I don't know all the specifics, so take that for what it's worth.
Yeah, yeah. I know some people really just like adhere to the whole like I just give them a dewormer once a year or whatnot, and it works
Same.
for whatever reason it
Yeah.
works. I mean, I'm not somebody who does that, but I did have to use Svenben on Pearl this
Yeah.
last year because she had a tapeworm,
Yeah,
so
exactly. There's a time and a place.
yeah.
Like if you're finding a parasite, like we don't want them to like just live happily in your pet's gut because it's going
Yeah,
to be potentially detrimental to them.
exactly.
So, but once again, this is where you can test and it's the whole like vaccine thing of they're due for their vaccines. Like did the immune system just stop working? Like, I don't understand. Why would they be due? So that terminology really just carries forward and we have to ask, like, what does that mean? How does the immune system actually work? What are vaccines actually doing? And it's the same thing with parasites. Just because it's like the annual doesn't mean we just like give everything
Yeah.
because you're here. We have to ask, does my pet benefit from this? Do they actually need it? And what does it do in the body? Those are all questions I want to know with everything that we are giving a pet and for myself too.
Yeah. It's funny because with most people, like with something like fenbendazole, most people are not super concerned and it is a relatively safe,
Yeah. Most
drug. And
dewormers are safe, to
yeah,
be honest.
yeah,
Like they're pretty
they're,
benign.
I was just going to say that was the word that was I was trying to find, and even the vet that we use here said the same thing. But I tried everything prior to before I went, and then I had the guilt of why didn't I just do Fenben sooner, right? But I
Yeah.
did. I went down the course of like let's try to see how I could treat this naturally, and
It's hard when
it
you
was
have a high parasite
yeah,
burden.
yeah. And
It's
tapeworms can be, to my knowledge, tapeworms can be a little resistant. They can be a little tough. So she
Yep.
needed that. She actually needed that course. And I was just, oh gosh,
Yep.
when that was over, I was like, thank God. However, I'm still waiting on the Innovative Pet Labs because we just did the comprehensive test on her. And it would be interesting to see if there's any remnants of that.
Well, you won't see parasites. You'll see if there's like inflammation or if you'll see like,
Okay, okay.
yeah, so you won't see parasites on like the innovative pet lab test and you won't see parasites on
Microbiome.
yeah, you won't see it on there because you're looking at like bacteria. So
Okay.
so this is where like a stool sample is really important. And there's a really neat company called Affordable Pet Labs.
I have that too.
So, yeah, Affordable Pet Labs is
Yeah.
fantastic because they're actually growing across the US. So, for overseas listeners, I'm sorry.
Oh,
Maybe one day there'll be more stuff.
yeah.
But this is where you can actually go to their website and order a test kit to come to you, and you can run a stool sample yourself and just check. So, if you're like, I don't know, this is kind of my pet's like maybe having parasites or there was an exposure, like you can always check it yourself too. I always say loop your vet in so they know what's going on, and share that information with them. But there's a lot of great resources now where you can do a lot of these tests yourself too.
Yep, yep, that's exactly. I have not done the Affordable Pet Labs test, but I have it here.
Yeah.
I think well, we're kind of like slowly tackling all this. Um,
Yes. One step at a time.
I know, like mom needs a nap over here. Okay, seriously, I'm like, oh my goodness, we need a little bit of a reprieve. But yeah, it's so awesome because I've been able to kind of like tackle some of this on my own without
Yeah.
needing to go. So it's been really helpful, and all of that information came from you, by the way. I learned that either from you just listening to your YouTube or from, yeah, I think it was YouTube. I think it was
Yeah.
YouTube.
And I have a free gut health guide too that has
Yeah.
like all these
Oh,
companies and the tests and three things. It's like it's very comprehensive. So
yes, it is. I
uh
have it. And if you guys, I'll put the link in this episode show notes again, but you guys have to download this guide that Dr. Katie has for gut health. It's so comprehensive. There's so much information and so many resources in there. And
yes. It's
I'm
like
like,
40
what?
pages.
It literally was. I'm like,
It's free
wow.
too, by the way.
Yeah, it's totally free. So make sure that you take advantage of that. It's amazing. Okay, let's see. Let's move right on along here. A female dog bladder infection. We were hey you and I were talking about this off air, except not really bladder infection related, but bladder
Mm,
health.
mm.
Female dog bladder infections, some watery blood in urine, needs help.
Okay, so just a disclaimer for all of these. I don't have background. I can't offer like specific medication supplements. Always go to your vet
Yep.
because obviously I'm not managing them. So just based on whenever I hear about um, signs of like a urinary tract infection, we need to make sure we're doing a urinalysis. That's number one. So we need to look at, okay, is there actually bacteria present? Are there crystals present? What's the pH of the urine? So that's going to give us an idea too of potentially are we at risk of an infection or certain types of crystals? Is there protein in the urine? Is there blood? We're seeing blood, so I'd expect blood. Blood coming up on a urinary, like on a urinalysis, will make protein go up.
Mm,
That's normal.
okay.
So expect that. And then also too, depending on this pet's age, a female is going to be more predisposed to a urinary tract infection, just like female humans can be. They have, shorter urethras, wider urethras. But I'm always asking, I don't know the age of this pet. So is this pet older? So are we dealing with something like kidney disease that might be developing? So ideally doing a full blood work profile. So that's going to be a CBC to look at white blood cell, red blood cell count, a biochemistry profile to look at like kidneys, liver, your protein levels, sugar levels. We need to make sure we're not diabetic. That's something that can happen too. If there's sugar in the urine, we need to make sure we rule out diabetes. Sugar feeds bacteria, so that can be very common. And so starting with those basic like blood, like full blood work and a urinalysis is really, really key because there can be underlying diseases that lead to a predisposition for a urinary tract infection. So, kidney disease causes dilute urine. We want concentrated urine because that's going to help prevent the bacteria from overgrowing. And then, of course, if there's liver disease, that can also create dilute urine. If we have diabetes, that can also create an issue. Add on a T4, that's a thyroid. Thyroid is huge and it's commonly missed for so many pets. So just do the full blood work, get a good baseline. If everything comes back normal, fantastic. You ruled things out. You don't have to worry about it, right? So if we find bacteria in the urine, this is going to be for I'm assuming money is no object at this point. I want to give people all the options. And if you can do these, fantastic. If you can't, just start at least with a urinalysis to see if there's an infection. If you see bacteria on that urinalysis, ideally you want to send it off for a culture because I've seen this with pets who have never had antibiotics and they had antibiotic resistance because of how much antibiotics are used in society. So that's the thing. We can be picking up bacteria from, you know, everywhere. And if we're picking up a strain that's resistant to, say, like clavamox or amoxicillin, that's the first go-to drug usually for a urinary tract infection. And so it doesn't mean you can't start that medication to help them feel better while we're waiting for the culture results to come back. That's okay. If your pet's doing okay, they're like not uncomfortable, it's not like super severe, we're not seeing any changes with like kidney values, then it's okay to wait the 3 days. However, I'd also start some supplements that things that like D-mannose is really helpful. We were talking about cranberry. There's a lot of great supplements there that are going to help your what is it? I always screw up the name. Your glycoaminoglycans or something like
Oh,
that.
yes. Yeah, yeah,
Yes,
yeah. It's
I'm
a
screwing up
long,
the name of it. However, essentially what we're doing is we're supporting the bladder mucosa so that it's less likely to be inhabited by bad bacteria. So we can start these supplements to just support bladder health while we're doing those things. And you can also continue them if you are using an antibiotic. But we definitely want to do the testing. If there's crystals, there can be different types of crystals. You might need a further workup if they're worried about like a bladder stone that can create blood. Worst case scenario, older pets, kind of red flag warning if you live near golf courses. There could be something like a bladder cancer. Probably not the situation, but I've worked with plenty of pets where they were going back and forth to the vet clinic for like UTIs, and they actually had bladder cancer that wasn't looked into with like an ultrasound or further diagnostics, and so they just kept seeing blood in the urine and all that inflammation was there setting them up for infections. But the problem was the bladder cancer. And the reason why I bring up golf courses is that there's actually studies that show a higher incidence of bladder cancer because of the amount of chemicals that are
Oh,
used on golf
yeah.
courses. And it's
Wow.
crazy. I've seen it with numerous patients throughout the years. Like, and whenever I hear I live near a golf course, and I'm like, oh God, like
Don't walk your dog in it.
detox. Yeah.
Yep.
And I mean, if you do, here's the thing. Once again, like fear, like don't
Yeah,
go down
yeah.
fear path. What can we
Right.
do about it? Wipe off your pet's paws, get them on, say, that ion gut that I mentioned previously. That's going to help bind like glyphosate, support the detox pathways, right? That's the beautiful thing is that, I live in a toxic area here. They like fog in the summertime. It's absolute. I'm like, who are you? What are we doing? Like,
Right.
what is this, the 1950s? And yeah, I won't know until like 2 weeks later, and there's an email, and they're like, "We fogged your house like over at nighttime. You're welcome. The mosquitoes will be less." And I'm like, mosquitoes fly, right? Like, but anyways, sorry, I digress. However, those are things like when we become aware of that, you just support yourself more. And that's what I do for myself and my cats is that I'm aware of that. I know that's a situation that I just have to deal with because I choose to live here.
Yeah, yeah,
So,
yeah. It's
so
not
that's
like you
the
got to
same
get
thing
up
with
and,
this.
like move if you live near a golf
Yeah, I
course,
mean, and we probably will eventually because I don't enjoy that, but like
Yeah,
right now it's not an option for us right now.
right.
So we just support ourselves based on that. So those are some of the things that I'd be thinking about if we're seeing blood in the urine, make sure you're doing those tests. We
Got
need
it.
to see what's going on or else you're just going to stay stuck and we can create long-term damage.
Okay, okay. Good stuff. Um, Dog has reverse sneezing. Well, reverse sneezing, potential reverse sneezing, or like little spasms sometimes, and sometimes when the dog gets really excited.
Mm-hmm.
I will just say right off the cuff that Tilly, this is Tilly too. Like she's 6 pounds, she's super tiny. Sometimes I think it's actually the way that she might have been bred. Because
Mm.
it's probably really narrow or there's some, but she a lot of time will do like that kind of
Yeah.
like honky reverse sneeze. And a lot of
Yeah.
times it is during excitement or it is. So when I see this,
Yeah.
I'm like, oh, this is something that I see and notice with her. Not so much with Pearl. It's very rare with Pearl.
Yeah, and it can depend on like the conformation. And also too, if pets are like predisposed to things like allergies or sensitivities too. But, when I see like the reverse sneezing, a lot of times just rubbing like the front of the throat can help calm them down to kind of get them into a more relaxed state. I don't tend to like get super concerned over reverse sneezing unless like it's happening all the time. Like cats, if they're reverse sneezing, I always get worried, especially if they're like they go outside, they can get a grass blade stuck up in their nose that's like stimulating the nasopharynx and triggering that reverse sneezing. So if your dog is continuing to reverse sneeze over and over again, it's not just related to excitement, then we need to be thinking like, is something kind of in the back of the
Yeah.
throat? And a lot of times, like when the vet does an examination, you can actually look up underneath the little flap in the back and you can kind of see, is there a piece of grass or something that's actually overstimulating them? But you'll notice like it's not going to stop. It's going to continue and you're going to be like something's not right, whereas this is more of like an excitement type thing.
Got it. Got it. Yeah, it's it's funny that you said sometimes just massage. That's my go-to with her. I actually just it doesn't I go down her spine a lot of times and I'll just
Yeah.
gently massage her spine and that's how she stops.
You're stimulating her parasympathetic nervous
Yeah.
system and
Yeah.
also too like the vagus, right? You're just
Yeah.
stimulating the vagus, you're getting them into a calm state. And it's amazing what happens when you just simple thing
Yep.
like that. So,
Can
yeah.
somebody just come behind me and just
Yeah.
can we
Can you just give me a massage too, please?
yeah, can we get somebody to
Like,
come over here and just like stimulate my nervous system, stimulate my spinal cord? I'm just saying.
I know. Where are these people?
Where,
If you know where they are and you're listening, let us
yeah,
know.
let us know. Let us know. You're getting a little bird's eye or bird's ear listen right now to Dr. Katie and I's off-air conversation because this is what all right, let's see. As we sort of, we're going to start to wind down here. So let's just tackle a couple more. Empty bile throw-ups occasionally in the morning,
Mm.
not often.
Okay. So this can be a number of things. A lot of times people will just do a later meal or a snack before bedtime, and that can make a big difference for these pets. So like start simple once again. I'm always like, can we do the simple thing first? So if that's not resolving things, do a microbiome test.
Mm.
So like before you start doing all the things, just do a microbiome test because a lot of times I work with a lot of like acid reflux pets. Yeah,
Oh,
very, very common. And on the microbiome test, I see it a lot where we have an overgrowth of E. coli. Very common. And then what's nice when we see that is we can use things like bacteriophages to like bring that population back down and kind of get things back into balance.
okay.
So in the meantime, if we're seeing like this isn't working, smaller meals throughout the day. So you don't want like tons of food in the stomach. But also too, feed earlier if you can. That might make a difference for this pet. The other thing too that I will use, slippery elm is helpful. So, like before you go to bed, slippery elm or marshmallow root, very soothing. It's a mucilage herb. So, it's going to help calm down inflammation. So, once again, very soothing. If there is any acid reflux that's irritating the esophagus, you can use that, before you go to bed and see if that just kind of calms things down. Ginger is another one too. So that you could always potentially use that's going to help with getting things moving through the stomach. And it also has a natural anti-nausea property to it. So just powdered ginger, like what you would use, is really beneficial also. Just like a pinch of it in the food would be fine to use.
Oh, that's a good. I might actually experiment with that because,
Yeah.
and again, though, I'm in the process of sort of discovery with Pearl, as we've now all know, because it seems like she's poor, bless her little sweetheart. But she deals with, and again, that's why I'm doing some of this gut work or these gut
Yeah.
workups with her because this is something that she also. I feel like some of these questions are very pertaining to
Yeah.
our little situation over here, but. Again, it's like this is like you said, common, not necessarily normal, but common. I find that
Yeah.
hers is typically in the middle of the night, like not
Hmm.
all, rarely actually throw up though, like not like this
It's more
person,
like
but
the licking, excessive
it's
gulping.
this
Yeah, it's the lid. So
over,
that's
yeah.
more your like acid reflux.
Hmm. Hmm.
So versus like bilious vomiting, which this person is like
Yep.
describing. So acid reflux is, there can be once again microbiome stuff, upper GI tract. This is also too where a lot of times that's actually due to not enough stomach acid.
Yeah. Yeah.
And so this is where using your digestive enzymes, but also depending on the pet, and you have to sometimes trial it and go slow, using betaine hydrochloride in that digestive enzyme. So we're helping to lower the stomach pH. So that way we can actually activate the enzymes to process the food. because what's happening a lot of times, the food's not breaking down, so it's staying just kind of stuck in the stomach. And it doesn't mean they vomit it back up, but it's like when you have a full stomach too, like if you've ever like going to bed and you're like, oh, and
Yeah.
then you're all grumbly, and then what can happen is as that passes through, if it's not broken down properly, it gets to the small intestine, it can ferment, and then we can actually create like SIBO. We can get dysbiosis further on. We can get food sensitivities. We can get leaky gut. That's where the immune system starts getting activated because it's like, why is this not an amino acid? Why is this a full protein? I'm not used to this. This is foreign, and they mount an immune response to it. And that's where you get like all these food sensitivities that can come from
Wow.
because it wasn't actually being processed properly at the very start of digestion in the stomach.
I'm going to plug your YouTube again because you have a really great video on your YouTube about this and
Acid
stomach
reflux.
acid. Yes, and I
Yeah.
watched that whole thing, and because I was considering putting Pearl on Zypan, which is
Yeah. Yeah.
but I kind of I'm hesitant until I sort of know more. But I
Yeah.
think I actually have put her on a couple or given it to her a couple times, but I haven't been
Yeah.
consistent because I just was like, let's just test, let's see
Yeah.
what's going on.
And that's
Um,
one of the things too that's really common. And like not every pet does well with betaine hydrochloride, right?
yeah,
And that could
yeah,
be because we actually need to calm down inflammation first. So if you see a reaction to that, or like a lot of people use apple cider vinegar too, which is a great one that you could trial, like a small amount of that. If you notice she like gets worse with it, with her symptoms, I would actually use just a regular, like broad spectrum digestive enzyme, like, pancreatin, and use that to help process the food. Use something like slippery elm or okra pepsin with standard process is a
oh
great
yes,
one.
yes.
I use that all the time for acid reflux. It works really well. Once again, every pet is different, so it doesn't mean it's going to work every time for every pet. That's the thing that keeps us on our toes.
Yep, yep.
So, but okra pepsin is really good because okra is also a mucilage herb and it's going to be soothing. And then you have your pepsin that a lot of times isn't getting activated because the stomach acid is not low enough to activate pepsin. Pepsin breaks down proteins in the food.
Okay.
So okra pepsin doesn't have the betaine hydrochloride, so it's more gentle. So you could always use that first, see how she does, and then you could progress to, you probably still need at some point, right, to add in the betaine hydrochloride potentially. But then once she's like more balanced and stable, then you add in the supplement, the digestive enzyme that also includes betaine hydrochloride. So that'd be like, then you progress to Zypan and you see how she does.
Huh. Okay. I'm so glad that this question was asked because I don't even think that I would. Yeah. This is helping you guys. Thank you for helping me. Just so you know, this
We're
is
all
really
in
a
it
show.
together.
This is really a show just for me.
You're welcome, Vanessa.
Yeah, right. But it's funny too because I'm just this week. Well, I guess I've given it to her before, but you mentioned apple cider vinegar and the bone broth that I have started to add just and again very small amounts. Like I give her a teaspoon or two.
Mhm.
It has apple cider. It's Small Batch Farms, and it has a little bit
Yeah,
of apple cider vinegar in it. So I'm sort of experimenting to see if that
yeah.
has any positive effect. And again, it could go. I don't know. I mean, we're on the fence
And
here.
and one of the things just to keep in mind too, because some dogs, we were talking about histamine before with itchy pets, histamine
Mm-hmm.
can play a part for pets with GI issues too, very common. Um, your bone broths, your fermented foods can also be higher in histamine
Yes.
naturally.
Yeah.
So if you're noticing she's not reacting well to that when you're experimenting with the bone broth, apple cider vinegar product together, separate out the two and use them by themselves. So that way, then what you could do, and because I work with so many sensitive pets, like I go slow. Slow and steady wins the race. And so many pets are so sensitive that we can't use a lot of different things together. And I don't like doing that because I can't tell what's working or if a pet's reacting. And so if you're going to like split out your bone broth and your apple cider vinegar, you would start with, say, like bone broth first. And you do that for like 3 to 5 days because we can have also delayed reactions to foods or supplements. So you're giving yourself space to see how does my pet react? Then you add in the next thing. So then you would add in like your apple cider vinegar, 3 to 5 days. How are we doing? Okay. And then like maybe then we go to whatever the next thing is. So that's typically how I like support pet parents through that process when when we've created a plan is it's not like here's all the things because most pets when they're well, the ones I work with anyways, are they just can't tolerate it. And you
Yeah.
send them into a flare and you're back at stage one. And now there's more fear and worry about even trying the next thing.
Oh, I know that feeling all too well. And just for someone listening, actually for myself too, again, but what would be something, what would you be looking out for? So say, for example, with this particular example, so say the, the bone broth that already has the ACV in
Mhm.
it, right? So if
Yes.
there was a negative reaction, what would we be looking for?
Yep. So a lot of times it's going to be like if your pet already has a health condition, it's probably going to be a flare up of those symptoms that you've been seeing.
Okay.
So, and a lot of times too, I mean, when we're giving something through the gut, usually we're going to see like there might be gassiness, there could be discomfort. They might do like more acid reflux, that licking, that kind of burping. Burping every now and then, not a bad thing, right? Like with us, sometimes you
Yeah.
just need to burp. Like that's normal. It's just like farting, right? Let's go there. Like you just gotta let it out, right? Same with pets. Farting every now and then is fine, but if they're really, really gassy, that's a problem. And if it smells really bad or sulfury, that's going to indicate also we probably have an overgrowth of like or an imbalance in the microbiome. So if you're seeing like the stool is changing for the worse, it's getting softer, you're seeing a lot of mucus, you're getting diarrhea, urgency, like that's a sign that we need to slow things down. It doesn't mean that it's not tolerated eventually, but we need to slow down. Don't continue the transition to adding a new thing in. Hold on. What I usually say, reduce your dose by half. Hold steady. Unless things get worse, then stop it, get back to a normal state, and then start with less. That's really, really important because every single pet, every single human processes things differently. Yes, we have dosages, right? And we have, concentrations that I'm calculating therapeutic dosages from. But what I found to be true through the years is that some pets just need a small amount,
Yeah.
and that's all they need. It doesn't mean that if they're doing great, this goes for everyone here. If you're using something and you're like, wow, that was really good, it doesn't mean you have to increase it.
Oh, good.
Even if the dose
Yes.
on the bottle says you need to be at this, just hang out there.
I
Just hang out there.
love
Your pet tells you everything you need to know in that moment.
Yes, yes, I love this piece of advice, and we should take it for ourselves as well. But
Yes.
I'm someone who starts really, really small. You know, I was mentioning to you off air that I had started Pearl and some antioxidant powder, some cranberry powder. I'm not giving her the full dose that's
Yeah.
recommended. I started at 1/4 of that
Yep.
just to kind of ease my way in, and I'm sticking in between 1/4 and 1/2 just for a little bit of time, just to see what goes on,
Yep.
because I'm not like, I just am really timid about going gung-ho with anything, even with
Yeah.
myself,
Yeah. Well, and once you go through health issues, like for anyone who's ever been through health issues, and I would say like the majority of probably like listeners or people who have found this path have been through something, whether it's
Yes.
for themselves or with their pets. Like we all get it. Like it is not the time and place to like, here's, the high end of the dose. Like it usually doesn't end well. And so, and that's also too what keeps people stuck where they're changing all sorts of things all the time because they're using the dose on the bottle. And a lot of times just even starting with a quarter like you've done, Vanessa, or a half and building your way up. This is what I do with my husband who has IBD. Like his immune system, his gut is more sensitive than mine. And so my dose that I take, he would not probably tolerate that. Doesn't mean that he's sick. He's in a great place, but I know that to be true that if I take something or, he can't tolerate it as much. Like mushrooms, for example, like it's food too. This is a great example. I love mushrooms, not magic mushrooms, but medicinal mushrooms. Let's just I've always
Let's
had that
clarify.
like, I'm in Colorado. Like I think it's clear to, good for you if you like. It, that's fine. It's not my thing. So, but like, button mushrooms, shiitake mushrooms, I love them. I love a lot of them and I do fine with them. My husband, he can't. He can't. And he'll have a little bit, but he cannot have them every day. So, like things like that, we are all individuals, and it's a matter of finding like what works best for you. And once again, just give everyone permission here. If something's working, don't take it as you have to increase that dose. Just hang out there
Yeah.
because your pet is showing you what their body is responding to, and that's probably the appropriate dose for where they're at.
Amazing. And I'm like your husband. I don't necessarily, I don't have IBD, but I love mushrooms, but I can only have a little
Yeah,
bit
they
because my body doesn't love a lot.
And it's the same. So it's interesting because there's a lot of great mushroom, products, and I
Yeah.
use mushroom powders in like my coffee in the morning and things like that. And I see it with pets too. And I've heard it from some of the people that are part of those companies, and nothing wrong with this, but I've heard where they're like, mushrooms don't cause that reaction. And I'm like, no, they do because I've seen it. Like, so that's the other thing too. Sometimes I think a lot of times I don't want to say I don't think that's full gaslighting, right? But the thing is if you are seeing something and you haven't changed anything else, recognize it for what it's worth. You don't have to get agreement from your doctor to say, oh yeah, like, I've heard so many things throughout our years going to gastroenterologists on the human health side. And I'm so grateful I didn't listen to all the things that were said to us. It doesn't mean I don't take it in and process it. And yes, we've definitely taken in and used a lot of things that we've heard and learned along the way. But if I just listen to, and I'm saying this for veterinarians too, and if something I'm saying doesn't resonate, question it. That's really important. But just because I say that doesn't have any side effects and your pet doesn't like that reaction, there's no way. I have learned that there can be a reaction to anything, anything, food, stress, supplements. And once again, it's just being in tune with your pet. And every single one here, like they wouldn't be listening to this if they weren't in tune with their pets. You know your pets. You know your pets better than your veterinarian does.
Amen to that. And so, yeah, and that's why you have to be so vocal and so intuitive, like we
Yeah.
were talking about. It's so true. Oh, it's just fantastic. I hope you guys are enjoying this as much as I am, but I am going to probably land on the last question because again, I literally have like six more or seven more here, but I was gonna
Part three.
part three. You're gonna come back at some point. I mean, come on. But let's go for this one. And I feel like you have sort of addressed this to a degree, but just because this is so specific, I would really like to ask you for this person. Can you heal pancreatic insufficiency in a dog?
Oh, I love this question. So Here's so this is where like the word, right? Like this is where you can definitely get a pet to a normal place with that condition. So for everyone here who's not familiar with this condition, it's called EPI for short. And it's where it's usually a congenital issue where the dog is not able to produce digestive enzymes. So the way it typically presents is this dog is just diarrhea everywhere. They can't process food, they are not doing good, they're losing weight. A lot of times the stool will look fatty too. There'll be color changes with it. They just are not doing well. So they go through a whole workup typically to get to this. And the way that we resolve this is that we provide the right supplements to support the pancreas with pancreatic enzymes. So we typically need higher amounts. And there's different brands. The brands that veterinarians recommend for this do work really well for this condition. And then also, too, though, is I take it one step further because we're usually having deficiencies elsewhere in the body too, right? Like if something's not made well, there's usually going to be other things that are off, right? And so once again, going back to like the acid reflux stuff and like the microbiome conversation, this is where I love doing those other tests to see like what other things might need to be fine-tuned to support this animal because they are working harder, but once you give them the right enzymes and you figure it out, they do really well. I have a couple dogs in my community that have this condition, and we've gotten them to a really good place. But it's always something we're keeping in mind is their microbiome also off? They can be born with a microbiome that's imbalanced because the mother's microbiome was imbalanced, and that can be passed on. They might not have gotten enough colostrum. Their immune system could also be struggling. So that's where, the innovative pet lab test that Vanessa you're doing can give you a really clear idea. The microbiome test, those two are kind of like my go-tos to start. There's other ones, but those are really helpful for getting an idea of the function and then also to the microbiome, the species that are present. So those would be things I'd be looking at. The the enzymes, a lot of times I'm also using something with like betaine hydrochloride, but once again, like if the pet doesn't do well with that type of enzyme, it tells us we probably don't need it.
Yeah.
So keep that in mind. We still need the other enzymes because we know there's an issue. Um, but I'm typically looking at those things and, thinking about all of the systems like bile production is a big one too that can be impacted, of course. So it's just like with digestion, it's not just about like the gut and the stomach. You also have like the gallbladder, the liver health, and the pancreas, and these other organs that are all interconnected. But once again, the testing really gives you a better idea of where things might be off or if things are great, right? Negative thing, I like ruling out things. When I see negative or that looks good, that's great. That's awesome. So you don't need to worry about that. And then you just retest every year. So that way you're taking that proactive approach. So we're just actually monitoring how is my pet doing. And the other thing too, I do want to say about those dogs is a lot of times their B12 or B vitamins are off. So this would be something too. Usually the test that the vet is running, it's typically a Texas A&M GI panel that's run to diagnose this condition. Typically has folate and B12 or cobalamin. Also, they're checking that. So I imagine they probably already checked that, but that would be something I'd want to keep an eye on. And I find that a lot of pets too with chronic GI issues, chronic allergies, are deficient in B vitamins, even with like great minimally processed diets. And what's really important for like the B vitamins are really key to liver health and detox. And a lot of people don't realize that for the different phases of detoxification. So if we're deficient, we're not going to be processing those toxins well. We live in a toxic world. It doesn't mean we need to freak out about it, but when we become aware of it and how we can better support it, then we can better support our pets and ourselves. So those would be the things and the types of tests I would be monitoring for a dog that has that known condition.
Awesome. Awesome.
And I still use
Well,
raw food diets for them too. So that might have been something that came up. I just wanted to throw
awesome.
that out there. Like they can still have like species appropriate diets. They don't need to be on, I find a lot of times they go on to prescription low fat GI diets. And I'm like, no,
Yeah.
because they're usually young too. And I'm like, no, 20 years of this food is not going to work well. Like,
Goodness.
we're not going to get to 20 years, with that type of food. Or
Yeah.
if you do, I'm not saying it can't happen. Obviously it can, but we want to up our odds, right, by promoting health. So,
Absolutely.
yeah.
Absolutely. Oh my goodness. Well, as much as I want to keep going, I'm going to I'm going to save your voice because I know you've got a busy day ahead of you still. But I will say that this has just been absolutely fantastic. I to say that I've enjoyed chatting with you on this show is such an understatement. I am not pulling your chain. I mean it with every ounce of me. I literally want to do a part three somewhere down the line because
There
there's
we go.
like you said, there's endless topics and
Yeah.
like us and why I think there's, I mean, still a fairly young show compared to a lot of shows, but I've recorded over 73 or 74 shows on human health.
It's
I mean, it's just
amazing.
endless. So it's like with pets, it seems to be very similar, right? It's just there's a
Yeah.
lot of parallels here. So, but for those that have requested more information on pet health and stuff, I just cannot think of a better person and doctor to have on than you. It has been such a joy.
Mm.
It's just really, really been so informational and also just so hopeful. Even for me sitting here, I mean, I've had so many relatable experiences or things that I'm going through as y'all have heard. And so it's been nice for me as well and helpful for me. So where can people again find more about you? Also with the testing,
Mm.
how can they go about looking further into the microbiome testing and the gut testing and all of those things that you've mentioned?
Yeah, thank you so much. I just want to say thank you to all your listeners too. I couldn't do what I do without, people that want to learn more and do the best that they can for themselves and their pets. So I really appreciate your audience and everything that you do, Vanessa. Like that comes from the bottom of my heart. So for people that want to learn more, we have a lot of content on the naturalpetdoctor.com, our YouTube channel, Dr. Katie Woodley, the Natural Pet Doctor, and then, of course, our social media. And then, as I mentioned earlier, I created that comprehensive free gut health guide. I really do recommend people download that and go through it. There is a lot of information there. I know sometimes it can feel overwhelming, especially if you're at the beginning. So, this is where I always say, what's the one thing that you can do? And just focus on that because one thing makes a huge difference for your health. And so grab that guide, download it, just start going through it and look at what can I do? Is it starting with a test? Because there's all the tests that we've talked about and more are listed in that. There are also some supplements to some like gut support supplements and things like that that you can look into also. So, and there's a lot of additional resources too. There's a lot of great books if you want to get into like making your own balanced diets, if you want to go deeper into any of these topics. I mean, there's a whole world of information out there that doesn't even involve me, which is fantastic. So I wanted to share a lot of those resources there too, because my beliefs, my experiences, my knowledge is just one piece of the puzzle. So so definitely check that out. And if you have questions or concerns, definitely reach out to us. We do work with pet parents a little bit differently that have gut health and skin health issues, but more than happy to see if we'd be a good fit together.
Awesome. Awesome. Yeah, I really encourage you guys to download the guide. I have it. It's so comprehensive, like I was mentioning earlier. And why not? A lot of this stuff, I mean, it's more information that you're going to get from an average professional in the pet care industry. It's full of information. So again, make sure that you download that. And again, these will all be listed in the show notes of this episode. Like always, some of them are also listed in part one, but I will relist them in today's episode as well for you guys. Again, it has been an absolute pleasure. I just adore you, and I cannot wait to talk to you again somewhere down the line, right? But I just feel like it's just been an amazing connection, and you've provided so much for us, and I just can't thank you enough. So again, from my heart, thank you for being here.
Thank you so much, and I'll see you soon.
I will see you soon. Okay, my friends, thank you so much. Have a very blessed day, and I will see you on the next episode.